Well, welcome and good evening, everybody. My name, for those who don't know me, is Donald Francis, and I am a chiropractor at Tweed Chiropractic Clinic, which is located in Hoyk and in Galashiels on the Scottish borders. So tonight's a bit of an experiment, and if it works, well, then hopefully we'll run more events like this to help people become better informed. We are planning one for 2 weeks' time on stress and the stress response and how that affects health and well-being. Please write your questions in the chat. If you save them up towards the end, it'll save me having to scroll through acres and acres of the chat to get to your question. I'm going to speak for about 25 minutes approximately. And if things are going well, just say so in the chat, will you? And if you don't understand something or ask me to repeat it, just say something again. And I'll answer questions at the end, okay? So pain is our massive safety mechanism, and it's a big subject and one that many people experience. So almost everybody that's ever come to see me has come or started their journey in chiropractic in some form of pain, but it's something that a lot of people really don't understand. So firstly, we need to understand what pain is, and then what and how we can do anything about it if we can. One of the first questions I always ask patients is the pain the problem, or is the problem the problem? So, is the pain the problem, or is the problem the problem? And the second question I ask is, where is the only place in your body where you feel pain? These questions are designed to make people think, and I believe we all otherwise slavishly take painkillers to dull or numb pain, and particularly if we don't understand it. So in order to answer these questions, let's consider the analogy of a hip replacement surgery, okay? Now, if I took a knife, very sharp one, and cut your skin anywhere on your body, but just say I did it in the side of your bum where you have a hip replacement, it would hurt like hell. And then if I took a saw and started cutting off the top of your hip, it would really hurt like hell. Now, our brain would be very acutely aware of an insult in the area of the hip, very acutely aware. In fact, the pain would probably be so intense that many of us would pass out. Now, if we take the patient and we give them an epidural, basically, we stick a very strong chemical over their spinal cord, which blocks the messages from the site of the wound to the brain. They can be perfectly awake, but they will feel no pain. Okay? So the brain would feel nothing. So where is the only place we feel pain? Love, being scared, being excited, being hungry, being tired. So where's the only place we feel these things? Well, obviously, it's in the brain. So many people come in and I say, where's the only place you feel pain? And they'll point to their back. Sometimes they're confused because they've got multiple areas of pain. But I hope I've just illustrated to you that the only place we actually feel pain is in our brain. Now, I want to make this absolutely clear. Somebody misunderstood me because he had some mental health issues. And he thought that I was telling him that he was imagining it. You're not imagining it. If you stick a dagger in your leg, it's going to feel blimmin' sore, okay? And your brain is going to be acutely aware of a very sharp piece of metal ripping through flesh and skin. But actually, if you had broken your back and there was no messages going from the site, you would have no pain. So what we have is at the area of the insult, we have lots of little microphones called nociceptors. Nociceptors. Is Latin for bad, and nociception is bad sensation. It's the posh word for pain. And nociceptors trigger a nerve response, trigger a nerve message to go up to the brain where some speakers in your brain light up. The more nerve receptors are triggered and the harder they're triggered, the louder the noise in the brain. So the more the pain, okay? And that's really how pain works. So As a chiropractor, you will often think about me as whatever you do, as a backcracker or a spine person or a pain merchant or whatever it is you have pre-framed in your mind. But I would really say that what we do is brain reprogramming. Brain reprogramming. Okay. So if we have pain, yes, it is real. Although your brain is the only place that will interpret that pain, something is stimulating it. And that something comes up nerves. So I, as a chiropractor, really am going to reprogram your brain to change function and allow you to heal. That's really what we do. We might, the various methods through the spine, through the cranium, through the pelvis, all of these things are our instruments, but what we're doing is we're changing how the brain-body connection works. Let's think about it. We have a wound or an injury, childbirth, anything that is extremely painful or not so painful. And if we block the path between that site and the brain, we will interpret no pain, or at least dull the pain. And that's how a painkiller works. Most of us culturally, therefore, think about pain as something that we must block out. Okay? So we take a painkiller, we take a pill, we take something from outside our body, and that something, that chemical, is designed to interfere between the microphone and the speaker. And that's it. And the stronger the stronger the interference between the microphone and the speaker, the more the pain is reduced. Okay. Before we try and get this, we must try and get a basic understanding of the nervous system. So for some people, this will be sucking eggs. And here's a Blue Peter version of something I drew earlier. Okay. If it doesn't work on here, I will. So what we have here is a little diagram, and up the top here we've got a brain cell, and down at the bottom here we have a tissue cell, any tissue cell you want in your body, a bone cell, a muscle cell, a stomach cell, a heart cell, a brain cell. Okay, now what you have up here is a message going from that cell to the brain. That's a sensory nerve, and this is going to send sensations of pain, of temperature, and of vibration, or any sensation that we're going to feel from our body, sight, hearing, proprioception, and it's going to send that up. And our brain is therefore going to use that information and send a motor message down. So if you have motor neuron disease like Doddy and any of our other friends who may or may not be listening, what happens is these nerves are attacked. So the brain can't send a message down the motor nerves, and eventually the muscles stop working because there's no message coming from the brain to make them fire. Now, if we have a wound down here in our tissue cells, and here I've drawn some Blue Peter blood, we can actually block that message of the pain by interfering with this nerve signal that goes from the body back to the brain. So we chiropractors call this the safety pin cycle. I think you can probably see why. We're going from brain cell to tissue cell to brain cell. And that is a cycle, and that goes on all the time in your body. In fact, you can't even blink or breathe without your brain knowing that your lungs are either full or empty, or your eyes are open or closed. That every single function, from digestion to movement of your hands to your hearing, is a function of that cycle between your brain and your body and your body and your brain and your brain and your body and your body and your brain. When we take a painkiller, we effectively block the messages completely, or at least dull the messages. So some pain is so intense that you take a paracetamol, it doesn't even touch it. Okay, you need to go up to your diazepam and your amitriptyline and these sort of things, particularly if it's nerve pain. Nerve pain, the pain is actually being elicited directly to the mechanism of transfer. So nerve pain can be quite incredible, actually. So what we have, all of us, are little pain receivers all over our body. And those pain receivers, as I've said, are called nociceptors, pain receivers. And they're just like little microphones that are listening out specifically for pain. We've also got little receivers all over our body for temperature, for hot and cold, for vibration, for pressure, and for movement. there's lots of sensations in our body which transmit up to our brain. Our senses are far greater than the 5 senses that we talk about within literature of sight, taste, smell, touch, and hearing. So the easiest way to kill pain is actually just to block the message between the site of the wound and the brain. But I want to use an analogy. So let's just talk about painkillers for a second. Some painkillers just act lightly on a state. Some change the whole physiology of the whole body. There's something like morphine actually makes people feel quite drowsy. It changes their whole state. Something like aspirin or paracetamol, a more mild painkiller, it doesn't actually have that big an effect on the person at all times. Whatever message you take away from what I'm saying today, nobody must go cold turkey off any of their medications, please. If you are on strong painkillers, don't go cold turkey off them. Talk to your doctor, because sometimes coming off those painkillers can be more dangerous than staying on them. So now we understand that pain is actually the brain's appreciation of a problem. Let's consider the 2 questions I posed at first. Is the pain the problem, or the problem the problem? Is the pain the problem, or the problem the problem? Well, when I ask that question, almost everybody considers the pain to be the problem, because that is the stimulus that has pushed them into doing something about their health. And where is the only place in the body you feel pain? The answer is your brain. So even if you're feeling pain right now all over your body, or in your lower back, in your knees, in your chest, in your mouth, wherever you're feeling pain, it is your brain that will be appreciating that pain. Okay, it's in your brain. Now, we can consider conditions for which people often see chiropractors. Let's think about back pain, neck pain, headaches, migraines, arm and leg pain, so on and so forth. These are probably the most common drivers into seeing chiropractors. As you will, I hope, have understood, the pain you feel is the effect of how your brain is understanding the problem. What the pain does say is not where the problem is, or even what is causing the pain. Okay? Sometimes when we try to self-diagnose because we've got pain in our hip, we feel that it might be our hip, when actually, most commonly, it's probably coming from your back. An example that is very easy to understand about this is a heart attack. Now, if I were able to ask you all, where do you feel a heart attack? And the answer is actually usually in your left shoulder, your neck, and your jaw. Can anybody think why? And the answer is because all the nerves that go to the area around the heart are in the same trench as the nerves that go to the arm, your neck, and this part of your skin. That's why, because the nerves that go to your heart are in the same trench. They're in the same wiring package as the nerves that go down to your arm. For those of you who are especially interested, we call this Hebb's law. Put simply, it's nerves that fire together, wire together. So you imagine we have nerves that go to our eyes, we have nerves that go to our nose, mouth. We've got a lot of nerves that go down our arm. And all of the nerves that come out of your left side of your neck that go down your arm are also in the same trench, in effect, come out of the same holes as the nerves that go down to your heart space, your diaphragm, some of the sensory nerves that go towards your upper viscera, and your ribs. So we can actually have, if we have problems that affect nerves that go to one area, because they say in the same trench, Hebb's law says nerves that fire together, wire together, we can end up having pain and or problems in both places at the same time. So at the beginning of this talk, I said that as a chiropractor, I'm actually a brain rewiring expert. And in order to change pain, whatever pain it is, acute pain, chronic pain, we need to rewire the brain. Now, if you have a gaping open wound in your leg where you have a big cut, you will reprogram that as the cut heals. Eventually, after a day or so, the brain itself will down-regulate the pain because it knows you're aware of it. You will still feel pain at certain times, but the intense pain at the moment of happening will be dialed down. But let's think about, as I said, those things that people come in to see a chiropractor about: back pain, neck pain, headaches, arm pain, and leg pain. Can any of you think of anything that you can do in your body without the say-so of your brain? Everybody try and blink, move your tongue, swallow, turn your head from side to side. Now, turning your head from side to side is actually a very complicated movement. You think you're turning your head. Now, we've got 7 vertebrae in here. We've got massive muscles on our neck and the back on the outside. We've got tiny little muscles in the bones of our neck on the inside. And all of those have got to move in concert. And all 7 joints have got to move like scales. The joints are going to slide over each other as we move. Okay? So it's quite a complex motion. Now, I've been learning how to turn my head since I was a baby. All of that is a set of programs which my brain has learned. Even blinking, breathing, swallowing, those are all programs. And they're programs that we just run because they're so repetitive, we do them time and time again. So if you think of a program, I'm speaking to you, and if you hear me, you may hear a Zimbabwean accent. I'm a Zimbabwean, but I've been living in the UK now for over 30 years. Over that 30 years, the programs that run my voice have changed from what I used to talk like when I first came over here. I had a much stronger accent, I spoke much faster, and I was much more clipped. Now, when my family from Zimbabwe hear me speak, they think I'm a posh pom, that my voice has changed so much. Now, what's actually happened is the software in my brain that controls the muscles of my voice box and my mouth has actually changed. Did you hear me use that word software? Everything about movements, moving my fingers, speaking, how I shape my face, it is all software programs. It's all software programs about how the brain controls the body. Okay? What we're going to do as a chiropractor is we're going to interfere with those programs, because what's happened in order for us to get pain is those programs have stopped working properly. And if the programs don't work properly, then the joints won't move properly. And if the joints don't move properly, eventually they're going to get swollen and they're going to get painful. So imagine we have a programming fault or a glitch in the middle of our neck. Now, I know one of the people listening here has right now a very painful programming glitch on the right side of her neck, which is interfering with a nerve traveling through that space and causing pain down her right arm. Now, what's actually happening there is at the space, from memory, I think it's C5 and 6 or C6 and 7. What's actually happening there is the joint, that particular vertebra, has stopped working. Now, it hasn't stopped working because a bone has decided not to move. It stopped working because the program that your brain uses to control those muscles and those joints has somehow got a glitch in it. And that glitch has stopped that working. Okay? Now, in that spasm, the reason why chiropractors actually get that, and we do a little click like that to get that moving, is in that moment when we're adjusting that, we're putting a massive sensory stimulation, almost like a tidal wave of sensation back up to the brain. And the brain is going to go, oh, I haven't been moving that for a while. I need to consider that in movement. And the reason, this lady, why you instantly feel a pain change is pain is the brain's appreciation of a problem. If we change how the brain sees that problem by making it work and move better, instantly the brain appreciates the problem differently and it dials down the pain sensation. Okay. Now, if those problems in your neck persist for months and if not years, the amount of reprogramming it takes, or they deprogram for years, the amount of reprogramming increases. Now, think of it like this. When an airplane or a helicopter first crashes out at sea, a distress beacon is sent out, and all of the Coast Guard and everything else can see that distress beacon is bleep, bleep. They know where it is. But if that distress beacon turns off, they're shooting, they have nothing to aim for. And they must assume that the airplane is sunk or whatever, and the people in the life raft aren't, if they're not transmitting, maybe they're not there. But if part of your body stops transmitting back up to the brain properly, what happens is the brain stops sending the right messages down to control it. So we end up with a cycle where we have a problem, and then the problem gets worse and worse and worse because the brain isn't using that space properly. If this problem persists for years and years and years, eventually we're going to get some changes in that space. And we're going to get little bony growths that grow, little spurs which grow to try and stabilize the joint because the muscles aren't able to. We might get discs which bulge into that space, pressing on nerves, which is very painful. And we're going to get other problems which are going to lead to pain going further down the line. And the further down the line we've got, the bigger the journey we have back. Because not only are we now got a pain problem, we've got a programming problem, but we've also got physical changes to bone and stuff. Now, they can change back, but it takes a long time. Now, if we think about the nerves which come from your brain down through your spinal cord and come out at C5, let's do it on the left-hand side, C5 here. Now, many of the nerves that control our biceps, our big muscle here and our arm, come out of C5. Okay? Now, if we have a problem with the nerves and the muscles that control C5, that's that vertebra there, Hebb's law says that nerves that fire together wire together, or those that are in the same trench will potentially have a problem. Not that they will have a problem, but they potentially will have a problem. So what happens is we end up with a problem at this joint, and this affects the nerves down into the space. So we might, if we have a problem at this joint, we might feel pain down in our arm. Okay, even though we're feeling pain in our arm, the problem is actually in our neck. But also, if it's C5, one of the nerves that goes down to our diaphragm and the space around our heart is called the phrenic nerve. The phrenic nerve. So it carries movement, muscle control of our diaphragm, the breathing of our diaphragm, the opening and closing of our diaphragm to allow food through. And if that stops working, we end up with acid reflux. Okay, so if we have a problem with C5, Hebb law says we might have pain in our arm, but actually we could also end up with weakness in our muscles. Now, the easiest ones to demonstrate is a weakness in your arm. So if you have one of these problems, next time you go to your chiropractor, ask them to show you the weakness. They will be able to demonstrate weakness. But if it happens down into the arm, it can equally happen down into the stomach area, which is why we think we end up getting acid reflux, and potentially why when you have something noxious happen in this space, the sensory feeling is down the left arm because all those wires are in the same place. If we have chronic back pain, for example, is the pain the problem, or is it actually that we've developed a problem in our back? So the number of people I've met over the last 11 years or so, who suddenly said to me, I did absolutely nothing, and all of a sudden I couldn't move and the agony was intense. Well, nobody goes from 100% health to being in that much agony. I promise you, it's like bending a piece of wire. You don't know when it's going to break, but it's going to break. And you use no more effort on the final bend than you did on any of the other bends. It just breaks because of all the previous bends. Okay? Now, as I've said, if the brain-body function problem, the programming problem, has gone on long enough to actually change the structures here, the body will always try and repair itself. It is a fact of life that we will always try and heal. I've had many cuts, stitches. I've had 3 broken bones. I've had a lot of stitches from rugby. I've had many torn muscles and sprains and strains, and they have all healed because I am designed to heal from birth. When you were born, a single cell with a blueprint for you that made me 5'10", blue eyes, made me the me that I am, was created. And that single strand of DNA is in all 100 trillion cells of our body today. So I have the blueprint for a new me. I am designed to heal, given the right opportunity. However, there are limitations of matter. Once I'm fully grown and I cut, well, if I cut my finger off, unlike a starfish, I can't grow a new finger. But if I cut my finger, as I have done here, 6 stitches, chiropractors shouldn't do that, it will heal. Okay, so if we have chronic back pain, and if we reprogram the brain to control that area better, then we're designed to heal. That is the principle of chiropractic. Now, I've lost my place on this piece of paper. Now, if, like I've said, if we have this brain problem between, say, the low back and the head, and if that, like that beacon out of the sea, the beacon, the sensory area from the spine stops working, eventually the problem gets worse and worse and worse, and the disc tries to stabilize until the disc bones, and then the bone, and eventually we're going to get to a point of so much problem that we're going to end up where the body is going to say to the brain is going to say, listen, Donald, I have tried everything. I'm going to give you pain now so that you do something to change your life so that I can heal you. Now, caveman would have gone into a cave and laid down for a week while cave women brought him his berries and his food, and all his mates would have gone out and hunted deer and all those sort of things. Okay, we have schedules. You know, I'm going to be in my clinic tomorrow at 9:30 for a whole day. You have schedules. You have breakfast time. You have lunch time. We have appointments. We don't like lying in the cave for 5 days, so we often take painkillers and do other things. Now, we are designed to heal, but the pain may go away in 4 or 5 days, but unless you change the program and start to reprogram the space between the brain and where the problem started, you're going to have these, and I've heard it so many times, oh, I've had the pain, it's been on and off for about 5 years. Every time I get it recently, it's been getting worse and worse. Those are people who are considering the pain the problem and not thinking the underlying problem is the problem which is causing or eliciting the pain in the brain. Okay. Sorry, give me 2 seconds. So when somebody says to me, I think it's a muscle problem, it's a joint problem, it's in the bones, I'm going to say that unless I break your leg or your bone, the problem is never in the bone, unless you have cancer in the bone. Say, unless you tear a muscle, the problem is never in the muscle. A joint, let's think about it. How well our brain, our computer and our software controls the body is the most important thing fundamentally for any problem in our body. We have a computer, our brain. It has software, programs that we have learned over our life. Some we're hardwired, such as swallowing. Some we're hardwired, breathing. Okay, but most are learned. Even standing up is learned. Okay, that sends a message along nerves. These control muscles. All a muscle can do is shorten the space between 2 bones. All a muscle can do is contract. In order for this muscle to relax, I must have an antagonist on the other side to contract. The muscle contracts and it pulls one bone across a joint. But nothing is ever a muscle problem. Nothing is ever a joint problem. Nothing is ever a bone problem. Things are almost always a programming problem. Now, that doesn't mean if you've got no cartilage left in your knee that you don't have a joint problem. You seriously do have a joint problem, but that has been caused over years and years and years of faulty programming and how your leg is running, how your brain is running your leg. Is the pain the problem, or do we actually have a serious programming problem that's running those 5 low back pain segments badly? Chronic pain And long-term pain must be understood. I know that there is somebody listening here who has seriously chronic pain. The firing of nerves, all nerves in the body, must reach a threshold. So when a nerve is fired, it's like electricity. You must have enough electricity behind it to reach a threshold for the nerve to fire. Now, the more we fire a particular nerve, the lower the threshold. So the more I practice a piano, the easier my brain finds to send that pattern. If the more pain I have, the more those nerves and the easier those nerves can fire. So the more we use our pain nerves, the lower the threshold for those nerves. Okay, so unfortunately with chronic pain, the more pain we have, the more we excite those pain nerves, the easier they fire, and the more of them will fire along the body, and eventually the painkillers won't work because those can just fire too easily and they can push through the painkillers. Remember, pain's in the brain. So actually the brain can actually remember certain signals and it can misinterpret them as pain as well. For many people with chronic pain, that often comes after chronic stress because the two are very intimately linked. And if you're interested in that, in 2 weeks' time, we're going to run a short seminar on stress too. So if you have chronic stress for a period of time, this can lower the threshold at which your pain can fire. And all of a sudden, you have chronic stress. You can stand on a round ball and it hurts, whereas somebody else, the tiniest stimulus is extremely painful to you, whereas to somebody else it's just a mild inconvenience. The nerves we fire most often are the nerves we fire most easily. That is probably one of the most important things. So if you play the piano, if you read, if you speak, the nerves you fire the most often are the nerves you fire the most easily. If the first nerves that fire in your life and the ones that fire all day are pain, those are the ones that fire more easily. If we constantly fire the nerves of anger, for example, we will always be angry. If we constantly fire the nerves of happiness, we will always be happy. And if we constantly fire the nerves of pain, we will always be in pain. Through constant repetition, all nerves fire more easily and therefore require less stimulation to elicit a response. Stress is a particular problem here. How can we therefore control pain? How can we control pain? Well, let's think about a fire in a building. This is a very important analogy. The fire sets off a fire alarm. This is like the pain alarm in the brain. If you don't like the sound of the alarm, you can ignore it. You can ignore pain. I used to be a soldier and often had to ignore pain. Or you can introduce another sound, for example, if you don't like the fire alarm. You can play the music louder so that you can't hear the alarm. So we can also do that. We can actually introduce more stimulation into our body. That means our brain picks up the other stimulation more than the pain. So we can try and outcompete the alarm. We could turn the alarm off. Okay, so that's a painkiller. We could actually turn the alarm off. Even though the fire is still there, we can turn the fire alarm off and just pretend the fire is still going. Or, and that's what a painkiller does, it just turns the alarm off. It does nothing about the fire itself. Or we can try and fight the fire. Now, if you ignore the alarm and you carry on firing the fire, you're going to have the while you're firing the fire, okay? And sometimes some people, I personally choose a life of no medication, so that's predominantly my choice. That doesn't mean that I haven't used pain medication. Sometimes I have, but I understand pain, and therefore I understand what it's trying to tell my body. I know some people are in such terrible pain that I'm not judging anybody. If you're in pain and you need painkillers, please take painkillers. Now, as a chiropractor, we don't turn off the alarm, so we don't treat pain. I don't know any chiropractor in the world who actually treats pain, and anybody who does is lying, because there is nothing that I have in the entire 16 years of learning that I have in my box of tricks that has anything related to pain specifically. Nothing at all. Okay, but most people come to see me for pain, and quite often we can do a hell of a lot for the pain in an instant. So we do try and drown out the pain, and I'll explain a bit more in a minute. And the second thing is we help the body put out the fire. This leads us to another important point. in any relationship between a doctor and the patient, who does the healing and who does the curing? What happened to the last person who cured anybody? And the honest answer is he was crucified. Okay? No doctor on the planet has ever cured anybody. It is the body that does the healing. My GP, my wonderful GP, whom I like very much, all she can ever do really is give me some advice or write a piece of paper. And I take that piece of paper to the chemist and I eat some pills and it still makes my body heal. Coming to the chiropractor, I can't heal you. All I can do is change your programming and allow your body to heal. And as your body heals, as in the fire goes out, the pain stops. But actually, point one, we can drown out the pain because we change the brain's appreciation of the body at any given time and space within the adjustment. We can often change the pain signals there and then. Not all nerves are the same, thankfully. Our pain nerves, our C fibers, as we call them, are non-myelinated. That means they've got no fat around them, which makes them slow. Our movement nerves, our proprioception, are incredibly fast. So the more we move, we can drown out the pain signal. So if you're banging and you hit your hand and you do this, lots and lots of sensatory signals go up to your brain and these drown out the pain. So a lot of people might say, I have incredible pain when I'm lying on my back in bed, but when I get up and move around, the pain goes away. Well, actually what's happening is as you're moving around, all those sensory stimulation from your body drowns out the pain because there's much more stimulation and it's traveling up a faster nerve to the brain. So that's the information that the brain gets more than the pain. You go to bed, you fall asleep, or you lie down, and when you stand, as you're lying down on your back, you get lots of pain because all of that drowning out sensation is not happening. So if we have a particular joint, let's click on L5 in our low back, and we move or we adjust that joint, or we change the brain's perception of that joint, we may very quickly, almost in an instant, change the brain's pain perception of that joint as well. Because in the instant of the adjustment, it will move better. And if it moves better, then how the brain appreciates it changed too. Okay. Now, the second and perhaps the most important thing we do as chiropractors is to reprogram the brain. Remember our ship that's lost at sea, or our life raft that's lost at sea, that's no longer transmitting a beacon back to land? Well, when we adjust you, what we do is we wake the body up. And all of a sudden, the brain becomes intensely aware of a space that it hasn't been aware of at all. It's almost like suddenly somebody waking up in our life raft and attaching a battery to the homing beacon. All of a sudden, it sends a message back to the brain. Now, if the brain's receiving a good, new, fresh message from that space, which it hasn't had properly for quite some time, it's going to send the proper motor signal back down. Remember our safety pin cycle? And that area is going to get to work. Now, as that area starts to work better, remember what I said, the absolute principle of chiropractic is that the body is designed to heal. The body is designed to heal. So if we reprogram the body properly, the body will heal. So if we then adjust you a few times and the pain goes, think about the fire analogy again. Once you've had a fire, the fire causes some damage. All damage in the body takes time to heal. When I broke my fibula playing rugby back in 2003, I went to an orthopedic surgeon and he said, you will be in a plaster cast for 2 months, and then you'll have about 3 or 4 or 5 months of rehab. 2 months was because the bone takes 2 months to heal. There is nothing in the world that I could do to expedite that bone to heal any faster. It was jolly sore too. And then when the plaster cast came off and hadn't moved for 2 months, my calf looked very thin and emaciated, but the area of my break was still red and bruised and painful. It took me 3 or 4 or 5 months even. I think I was still in pain when I was running about 6 months later, to rehabilitate the area of soft tissue, because that was damaged too. But also because I had damaged all the ligaments and tendons and nerves in that space, and then not used them for 2 months, I had to completely reprogram how my brain controlled my ankle. And if we take that analogy into our low back, most people don't break their low back. Some people do, but most people don't. Most people, it's merely a chronic or acute low back pain problem based on a programming fault between your brain and that area. The first part of it is to get you out of pain, and we do that by changing how the brain perceives that state. And that is usually quite quick. The second part of it is the long-term rehabilitation. It's the reprogramming of that joint space so that you no longer, so that the brain becomes acutely aware of that area and you don't fall backwards into the bad programming you have. Now, here's an example of falling back into bad programming. As you hear me speak, you have the accent of a 46-year-old male who's lived in the United Kingdom for 30 years and grew up in Zimbabwe for the previous 17 or 18 years before that. If I get very tired and drunk and I lose my frontal cortical control, I will automatically slope back to my old habits. It's the same with our back. If we get out of our control of our low back, we will actually slope back to our old habits, which were the habits or the programs that caused the problem in the first place. So after the pain, we have the rebuilding phase. That's where your body is actually going to change shape back to being good, but also most importantly, and that's the time it takes for your brain to reprogram. So after I broke my leg, after 2 months, I could walk with a hell of a limp. It was a hell of a painful. And it took about about 5 months, I think, to rehabilitate my leg to the point that I could run without pain all the time. Okay? Now, so this has been a slightly longer than I anticipated, but a brief run through about pain in general. Chronic pain is long-term pain. If we have chronic pain, what has happened is that parts of our body are stimulating those pain receivers far too easily. This may mean that tissues within our body have changed quite significantly. And if they've changed quite significantly, it is actually quite difficult for them to change back without a lot of effort. And that requires you not only to see people like me, perhaps, but also to change your lifestyle that caused that potentially in the first place. Pain can be helped by drugs and it can be helped by chemicals, but they don't ever fix the problem. The only thing that can fix the problem is you. If your brain doesn't know how to fix the problem because it is no longer running or using the correct programs to work a particular part of your body, then that's where you need somebody like a chiropractor or potentially a physiotherapist or something like that to reorganize or reprogram your brain. I've used that word so many times. It's not about the pain, it's all about the brain, okay? So, do you have teeth? Do you have a dentist? Do you have a spine, cranium, pelvis, legs? Do you have a chiropractor? I've been going to a dentist for 45 years and I've still got all of my teeth, okay? And I can live without all of them. But I didn't start actually going to a chiropractor really regularly until I was in my mid-30s. But I can't live without my spine. I now have almost no pain most of the time, and I can run and ride and do whatever I do. So what we do try to encourage people to do is to proactively look at your health rather than reactively look. We're coming to the end now. If anybody has any questions about pain, please write them in the chat that's at the bottom left-hand, or certainly the bottom, I beg your pardon, the bottom right-hand corner of my screen, and I'll do my best to answer them. Don't all write at once. Okay, if no one's got any questions, I was hoping we would get a couple there to stimulate that. Everybody found that useful, I hope. And if you're interested in more, I mean, it's such a big subject, get us a message on Facebook, message the clinic Facebook page. I'd love to I'd love to try and have this discussion. If people understand pain, I think they will respect it more and understand what it means and try and do the best they can to beat it. Thanks very much for that. Okay. Well, it's been lovely having you. If you're interested at all, 2 weeks today, and I will desperately try and stay to 30 minutes. We're going to run another webinar on stress. And stress is the new smoking. It is what's going to kill more of us than anything else. So if you're interested in that, please just go through the same mechanism. We'll put it through the Facebook page. Just click on that. This is being recorded, and it will be available through the clinic page. Okay, so thank you very much all, and we hope if we know you, then we would love to see you. If we don't know you, then and you'd like to get in touch, Facebook's probably the easiest thing. Okay, take care, guys. Bye-bye.